Have any Redditors been diagnosed with coronavirus yet? If so, what is it like?
I'm infected with coronavirus, on day 5 since I contracted. I live in Madrid, that's on soft quarantine, but nobody respects it. Our health system is collapsing. Ask me anything. We know the exact day and time we got it because the person who tested positive had the organization send us a missive. We contracted it on Friday around 1400 hours. My husband and son seem pretty asymptomatic, though my husband has been having headaches. I have had a fever and throat ache, along with an insistent dry cough. My 2-year-old toddler had a 1-day super low fever and that's it. We self-quarantined immediately upon receiving the news on Tuesday. I started having symptoms on Monday, but thought it was just allergies, flu. We tried to alert the government ASAP, but all emergency lines were collapsed. We got hold of a person after waiting for 4 hours on hold. It was at 3 a.m. when they answered. They told us to self-isolate and that they were collapsed. Since I'm having symptoms and they have a case number of the person who tested positive, they are assuming we're all positive. They told us to not go to a hospital even if we get worse, to just call for an ambulance, but that's a 4 hours waiting on hold kind of thing. Anyway, Ed said, I agree and disagree with this comment. For a few reasons. I want to agree with the fact that they're underestimating it. I want to disagree with why, however. I don't believe they're underestimating it because of the media's hype, which is justified. I believe they're underestimating it due to their ignorance on the matter. They haven't taken the time to look at actual reports, data charts, and asks why it's so serious. To be brutally blunt, the common person, regardless of life experience or age, is a blithering idiot. Now, don't get me wrong, I don't like calling people stupid. I'm not even saying I'm above the common person, because I'm right there with them. I do my research, I try not to panic, but I'm still a blithering idiot just like everyone else. It's hard to admit that, but it's true. But still, we have no vaccine yet. Everyone who hasn't been infected doesn't have any tolerance for the virus. I live in Italy and the media isn't overreacting. My whole country is quarantined, until the 3rd of April, because people keep getting sick and hospitals have not enough beds for them. Doctors and nurses are working 18-hour shifts and they're not enough, so they started to get nurses from college. In my city, Rome, the peak is expected to be in 6 days. You could start buying some food and try to avoid crowded places. Here they are not closing supermarkets, so there's plenty of food. It's real. Masks won't save you, but save other people from infection. Our emergency lines are collapsed, our hospitals are collapsed, they aren't coming to test us, we just gonna ride it out. They are assuming we have it because of the contact. It's pretty scary. I'd feel much safer if I lived in the country. And also everything the Italian person that replies more severe symptoms than influenza does. The younger and healthier you are, the more likely and more quickly you are to recover from COVID-19. Now, for those that don't know, coronavirus is the name of the actual virus, and COVID-19 is the name that has been given to the actual sickness that it causes. Just like influenza is the name of the virus that causes the flu. Now my advice to all of my fellow common folk, educate yourselves about the virus. I got all of this information just by going online to look at data and information gathered on actual medical websites with certified doctors. Exactly, the media is causing people to become extremely selfish with their hoarding of unnecessary supplies. Today I was at the grocery store and witnessed people buying 5 to 10 packs of 20-roll packs of toilet paper. The store sold out of them within the 10 minutes that they put them out. I understand people wanting to stay inside, not get sick, but seriously, the greed is real. We were just low on toilet paper and needed some. There's none in town. We are in Idaho, US, one of the few states that doesn't have it. It's going to be even crazier once news hits that people here have it. If you were to run out of supplies, how would you restock? Because I'm assuming you don't want to leave your home. Amazon still works and we have options out of town in the country. How old are you and your husband? I'm 31 and he's 36. You're probably gonna be safe then. Tossed around, or maybe something more catchy? I wish there was some better wording for that last sentence. Slower, like the flu is, once people have a tolerance and there are vaccines in circulation each year. For influenza, the fever shows after an average incubation period of 2 days. Most people have gotten influenza before, and probably a flu shot or a flu mist. That shortens the incubation period. Once coronavirus has been around for a little while, meaning about 5 years after a vaccine is developed, at bare minimum, I'm sure the incubation period for COVID-19 will start to get shorter and shorter. Coronavirus is prone to How long did it take for your services to collapse once local people started testing positive? On Tuesday it took me 4 hours to get hold of medical emergency. On Wednesday it took us 6 hours. We only called because the symptoms really hit. They said to take paracetamol and not leave the house. Today all phone lines are collapsed, including 112, 911 for Americans, so if you cut your arm off, or there's a crime, good luck. What do you mean by collapse? Like if you dialed 911, or whatever the equivalent is in Spain, are you not getting through to someone? I dialed our 911 and got a busy signal, so I quit adding to that, but I tried all other lines too, including police. It's pretty scary, so I'm looking to hide out in the countryside once we recover. Sending good wishes for you and your family for good health and a speedy recovery. I am by no means a doctor, but I am 40 years old and have been living with chronic severe asthma since age 3 and have spent many weeks in the hospital with flu and cold, and one time had pneumonia. It seems like you and your family have crossed the danger threshold and are on the way to recovery. But if you find that you or someone else starts to take a turn for the worse, and since the health system is overwhelmed and useless, these are some things I've learned you can do at home. I would look at going on Amazon and ordering oxygen. If your lungs do get compromised, this will help get much needed oxygen in your blood and to your organs when the lungs are having a hard time performing its job. Also, you can also order rehydration tablets and salts from Amazon too. While it's not an IV drip from the hospital, it is a decent alternative you can take at home. Or another good way to stay hydrated is from Pedialyte or Gatorade. Just anything that will replace the valuable electrolytes you need. Hoping for all the best as you, your family, your country and the world go through this epidemic. Great advice, thank you. I wish you all the best too. I've had asthma attacks due to extreme pollen allergy a few times. It's pretty scary. I hope you stay safe and avoid everyone. I never thought I'd catch it. Nothing really weird, it just feels heavy to breathe now. So I'm hoping I'm getting over the worst of it. What are you feeling right now? Is it scary to get infected by coronavirus? It's a bit scary. No real answers or medical support. Your chest feels heavy. I know it's shitty. Also, all our emergency lines have collapsed. There's nobody coming to save me if this gets worse. Are you wheezing? Not so far. If you do start wheezing, try to keep drinking hot caffeinated beverages. I have asthma and that's what I've tried to do when I didn't have an inhaler. I have salbutamol inhaler from last year when I had bronchitis. And I also drink a ridiculous amount of coffee. Thanks for the tips.
Thank you for watching. Please subscribe.